Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Natra binti Muhammad Hia. I will talk about heart attack and my experience as a patient. Okay, heart attack is the number one killer for both men and women in Malaysia. Your heart is one of your body's most important organ. Most of those who will suffer heart attack are from the elderly, and some are dead from newborns. The percentage of heart disease attack in Malaysia is increasing from time to time. Although heart disease can occur in different forms, there is a common set of core risk factors that influence whether someone will ultimately be at risk for heart disease or not. A heart attack is a sudden blockage of blood flow to our heart. Without adequate blood flow, your heart muscle can get the nutrients and oxygen it needs to function. Symptoms include chest pain or discomfort, heartburn, nausea, sweating, and more. During a heart attack, a plaque can rupture and spill cholesterol and other substances into bloodstream. A blood clot forms at the site of the rupture. If the clot is large, it can block blood flow through the coronary artery, starving the heart of oxygen and nutrients that we call ischemia. Many do not know that most heart attacks occur suddenly in an unexpected situation. I am one of those who have experienced dealing with patients who have had a heart attack. It happened very quickly, and thank God the patient immediately went to the hospital and was successfully rescued. But who knows what could happen if it's a few minutes late. But what surprised me even more as a family member was the sign of a heart attack that were not as we expected. That's why it's important for you to know the sign of a heart attack as well as the steps to take during the trip to the hospital. The most common symptoms of a heart attack include chest pain, upper body discomfort, and shortness of breath. Other warning signs may include like headache or sudden dizziness, cold sweats, nausea and vomiting, heart palpitation, heartburn, and extreme fatigue or exhaustion. If you experience symptoms that may indicate a heart attack for longer than 5 minutes, it's important to seek emergency medical attention immediately. Don't delay the treatment by waiting to see if your symptoms go away. Even if your symptoms let up or change, there may be ongoing damage to your heart. If treatment begins within an hour of the onset of symptoms, a heart attack is less likely to cause significant or long-lasting damage to your heart muscle. Unfortunately, many people delay treatment for a heart attack by several hours, increasing the risk of long-term disability or death. Depending on your treatment needs, you may need to be hospitalized for a heart attack for several days or longer. I feel chest pain and sweating. One morning, I started to feel pain in my chest and sweating. I felt unaware that what was going on was a heart attack, but I was in a safe place, and my parents took me to the hospital, and I was connected with an electrocardiogram (ECG) immediately. I was shocked when the hospital staff told me I had a heart attack. I rushed to have surgery and put in one stent. I went back to surgery and had 2 more stents. Then the doctor told me there was evidence that I also had a stroke and heart attack. And now, today I feel great. I still have a good and bad day. When I wake up every morning looking at the day and the opportunity. I have learned from my heart disease and now I take better care than before my heart attack. After a while, in the middle of my rest, came a strong attack until the whole limbs stiff, finger palm cannot afford to grasp. I was only able to hold back the tears that came out non-stop. At that time, without delay, my mother and father continued to turn on the car engine, and I was still able to walk to the car. But it was like a robot because all the limbs could not be bent. Arrived at the clinic, the doctor told this muscle pain. The doctor for a needle and thought immediately to the hospital. Feel like digestive problem or stomach ache. After a few minutes, I started to feel like I was having digestive problem, but not too severe. It started to increase, so I went to take some aspirin pill. My mom asked, "Are you okay?" My face looked pale. The discomfort then become sore and spread to my hand. My arms seemed to turn into jelly. Then my mom and dad took me to the hospital, even though I started to feel good. But my mom reluctant to break back. Shortly afterwards, I was told by the nurse that I had a heart attack. I feel pain in my stomach, like I wanted to throw it away, but instead I didn't feel it. This stomach ache problem causes what I eat to not be able to digest properly. Arriving at the hospital, I was rushed to the emergency room. After being pricked for a while, I feel a little relief and was able to walk into the emergency ward for an examination after making a screening that we call ECG, electrocardiogram, at the emergency counter. I was sent to the critical section. After I lay on the bed, I saw many people like nurses and doctors around me. Then I lost consciousness. After an hour and a half, I woke up and I was shocked. My whole body was full of tangled wire. The mouth of the nose was covered with an oxygen device, during which a time a doctor came calling my name and tried to interact whether I was conscious or not. After looking, I was completely conscious and he told me that I had a heart attack. I can't believe I'm still alive. That is experience only people who suffer like me will understand. What is a heart attack? What is a stroke? What is a stroke? I remember when in the ICU, the patient next to my bed, left and right, was a critical stroke patient, coma over a week. Then I only remember dying. Thank God my life is still long. The fourth day I was transferred to a regular ward, and the sixth day I was allowed to go home. While being transferred to a regular ward, the thing I can forget are the day when people die in the ward, everything related to stroke, heart damage, all sort of things. This experience that I went through really made me repent, moved to share with people, healthy people. After that, my life routine changed 100%. I had to take medicine 3 times a day. I couldn't work hard. I was admitted to ward several times. I was admitted to ICU, CCU, CHW that we call cardio. On my experience, I want to give the conclusion that during a heart attack, symptoms typically last 30 minutes or longer and are not relieved by rest or oral medication. If anyone thinks that he or she is having a heart attack, he or she should not delay, should call for emergency help if no one can help. Immediate treatment of a heart attack is very important to lessen the amount of damage to your heart. Prepare yourself to prevent the cardiac condition from today. From today, only eat the right diet and practice lifestyle. Don't wait for something to happen to take any step. That's all that's all from me, and that's all my story and my experience about a heart attack. That's all from me, my experience as a patient of a heart attack. Thank you.